some, and then we'll have Abhish. Yes, Raja.
Yeah, thank you once again, Dr. Lalit, for the invitation. Actually, I'll go straight to my cases. I think we have heard a lot about the general things about AMD and Brolucizumab. So this was the patient that I was talking earlier, 89-year-old female. You can see the pigment epithelial detachment, intraretinal fluid, and vision was 21-25. She came in January, and this is how it is. I mean, I'll show again the before the injection. This is after the injection. So it's an amazing result. I mean, you may not get it in all patients, but brolucizumab has that effect, which is not seen in other molecules. But that patient didn't come because after March there was second wave, and then she has not yet come back. This is another patient, a 62-year-old male, came last year, October, almost a year ago. And you can see in the left eye, there is subretinal hemorrhage, a roundish lesion here, some amount of exudates. Vision was 2020 actually, because this patient had subretinal hemorrhage and a nodular lesion. We did an ICG and it showed branching vascular network with polyp. And as you can see here, compared to the previous ICG where the network is limited, the later phase showed that there is extensive network here and there's a polyp here. So it's a big lesion, and we gave first brolucizumab in October, and after about 5 to 6 weeks, this patient still had some amount of subretinal hemorrhage. OCT angiography shows the branching vascular network doesn't pick up the polyp that easily. Polyp doesn't go away; it didn't go away, but OCTA did not pick up the polyp. And this is 18 January 2020 vision. And in February, this patient, after we advised, patient got the injection in February, and you can see the very nice, almost complete reduction of PD. There's no intraretinal fluid. In April, we did this patient's ICG, and as you can see, the polyp is still there, although it's much less intense. And you can see the late geographic hyperfluorescence here. It's a pretty large lesion, but overall the polyp had changed a little bit. But then this patient also had some PED, and we gave the fourth injection of Paginac. This was at an interval of about 2 months. And in July, this patient again had reduction, and we did not give any further as yet. This is another patient with occult CNVM. Patient had come last year, 90-year-old. We injected brolucizumab. This patient had subretinal fluid as well as intraretinal fluid and shrum. This is after one injection in November. I did not repeat the injection at this point of time, but in December, when the patient came back, there was recurrence of subretinal fluid. We repeated the injection. Again, the fluid went away. So the ARMD can come back, fluid can come back, but whenever it comes back, you can give the injection. And as you see here, again in February, there's no fluid. So I think I would stop here, or maybe one just small case. The 63-year-old who came in March. This eye had kind of bacillary detachment, which is not usual in ARMD, and also some amount of subretinal fluid. We gave one injection of ranibizumab in March, but there was not much of a response. There's still some amount of subretinal and subretinal fluid, but this time in April we gave brolucizumab and it's gone. So it's a very nice drug, dries the macula very nicely. I'll stop here. Over to you, Dr. Lalit.
Thank you, Raja, for